Hello everyone! Today's video is about a very important structure in our bodies, our skeletal system. It is magnificent. It literally takes you to places. It makes you able to move, stand, sit, dance and walk. Our joints makes us bend, tilt or even twist. Besides, our bones and joints carry our body weight. Our role today is to answer most of your questions regarding knee arthrosis. Today we have Doctor Eun, who is a leading doctor at Wooridul Hospital in Gangnam. He is going to discuss with us everything about knee arthrosis from an experienced medical point of view. Hi Ume, before we start, please subscribe to our channel so the next time you'll be updated with our new releases. Can you please explain just a little bit about knee arthrosis?
There are two bones in the knee like this, the femur, then the tibia, and the meniscus between them. As we age, the meniscus begins to tear due to degeneration. And as the bones come into contact with each other, degenerative arthritis occurs.
So the knee joint is arched, right?
Yes.
So how do you diagnose that?
The easiest way is to take an x-ray, but in the case of elderly patients who are over 60, when they visit the hospital, their cartilage is already worn out, so we can see the deformation on the x-ray. But now people younger than that have a catching sense of the knee. That is, when they bend and straighten their knee, the inside of the knee hurts or the knee swells. This is a symptom of a meniscus tear. When it comes to such symptoms, x-rays and MRIs are taken to check for cartilage damage inside.
So after the diagnosis, if it's confirmed that it's a knee arthrosis, what kind of treatment can be done?
When we say that we have degenerative arthritis, we divide it into stages. First, meniscus tear, then early arthritis, and then middle and late stage arthritis. The meniscus tear is also divided and can be repaired with endoscopic treatment by drilling a hole with an arthroscopic meniscectomy, which cuts slightly. And it might be in the stage of meniscal repair that needs to be centered when the cartilage is torn. However, when it's said that the arthritis progresses and becomes worse, if it is the last stage, the final stage of arthritis, artificial joint surgery is performed. Total knee arthroplasty is an operation that removes the bad joint and inserts an artificial joint so that the patient can walk comfortably and there is a gray zone between them. At this point, there are various treatments. It can be stem cell transplantation, and then, for a patient with various deformity, in which the leg is bent into an O leg, then HTO or high tibial osteotomy can be performed to straighten the leg like this. And of course, between the two, you should first try to control the pain by taking medicine and injecting, and in a way to lose weight and to improve the patient's symptoms through thigh strength training.
So in the case of arthrosis, is there also a way to prevent it? Like a certain posture you should follow, or for example, a sport you can do that could help?
To start with something that can prevent the knee arthritis, it is best not to do movements that can impact the knee, such as going up and down stairs, and then running a lot constantly, like a marathon. These cannot be good exercises for the knee. The knee joint is a weight-bearing joint. Therefore, it is important to lose weight because the weight is constantly being put on, making it stressed and damaged. Then, it is not the meniscus that absorbs this shock, but the thigh muscles. So doing squats or leg extension exercises to strengthen these thigh muscles can help.
So you talked about that you should also reduce your weight in case of overweight. So can we say that diet also can affect arthrosis?
Diet is very important. Losing weight not only reduces knee arthritis, can also reduce pain.
My next question is very frequently asked by people. So who's more likely to get arthrosis, women or men?
Women. Women are more likely to develop osteoporosis after the age of 55 to 60 due to the hormonal problems. In men, the legs are often straight like this, but there are many cases of virus deformity in women where their legs are not straight, and is bent in an O shape like this. So when various deformity occurs, the medial joint in the knee becomes very narrow, the cartilage is torn, and degenerative arthritis occurs a lot. So there are a lot of degenerative arthritis among women.
So today we learned many things about knee arthrosis in detail, such as its symptoms and treatment. Thank you for joining us once again today at CloudHospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.